In this video, I will go over the features of Hodgkin and non-Hodgkin lymphomas. So Hodgkin lymphoma has a bimodal distribution, being most commonly seen in 15 to 30 and more than 50 years of age. So it has a bimodal distribution like this. So here would be 15 to 30 and here would be after 50 years of age, versus non-Hodgkin lymphoma, which is most commonly seen between the ages of 20 to 40. Risk factors to Hodgkin lymphoma include Epstein-Barr virus, while risk factors to the non-Hodgkin lymphoma include EBV. With Burkitt's lymphoma, it also includes HIV, immunosuppression, as well as the human T lymphocyte virus 1. Hodgkin lymphoma is being spread contiguously, meaning that it spreads from one lymph node to another, while non-Hodgkin lymphoma spreads non-contiguous and can go extranodal and affect the spleen, liver, and bone marrow. And finally, the clinical features of Hodgkin lymphoma include the painless lymphadenopathy and B symptoms. And B symptoms include, for instance, fever, night sweats, and weight loss, while non-Hodgkin lymphoma presents also with lymphadenopathy and less commonly B symptoms, but these patients can also have hepatosplenomegaly. So starting with the Hodgkin lymphoma, it's divided into 4 types. The nodular sclerosis type, which on the histology you will see bands of collagen. Then we have mixed cellularity, where you see the Reed-Sternberg cells in a pleomorphic background. And then we have the lymphocyte predominance, which has many B cells, as well as the lymphocyte depletion. And this lymphocyte depletion has the poorest prognosis versus nodular sclerosis, which has the best prognosis. For the diagnosis, you will see Reed-Sternbergs on the biopsy of lymph nodes. So here is an example of a Reed-Sternberg cells, which are enlarged cells with 2 nuclei that have owl's eye appearance. And these cells are B cell origins that are positive for CD30 and CD15 receptors. And then you should also know that the Hodgkin lymphomas, as well as some of the non-Hodgkin lymphomas, present with the paraneoplastic syndrome by producing the calcitriol, which is a 1,25-dihydroxy vitamin D that can increase the calcium absorption and thus can cause hypercalcemia. Next, we have the non-Hodgkin lymphomas, which can be formed from the malignant transformation of the B cells as well as T cells. And then about 85% of these lymphomas are from B cells, while 15% are from the T cells. And as I just discussed earlier, non-Hodgkin lymphoma is more commonly seen between the ages of 20 to 40, spreads non-contiguously, and thus it can spread to the extranodal sites, like for instance spleen and the liver, and can cause hepatosplenomegaly. And then the clinical features of non-Hodgkin lymphoma include the lymphadenopathy. Less commonly, it presents with the B symptoms, such as fever, night sweats, and weight loss, and then it can also present with the hepatosplenomegaly. Common risk factors include the Epstein-Barr virus, which is seen with the Burkitt's lymphoma. It includes the human T lymphocyte virus 1, which is seen with the human T cell leukemia or lymphoma, and then also HIV and immunosuppression are the other risk factors to non-Hodgkin lymphoma. So as I mentioned earlier, 85% of these lymphomas are derived from B cells, while only 15% are from T cells. And next I would like to go over those. So here we have Burkitt's, mantle, follicular, and diffuse large B cells, which are all derived from the B cells. And then next we have the mycosis fungoides and adult T cell lymphoma, which are derived from the T lymphocytes. So let's go through these. So the first condition is Burkitt's lymphoma, which is a B cell lymphoma that is more commonly seen in Africans with Epstein Epstein-Barr virus infection, and it commonly affects the jaw and the facial bones. And on the histology, you will see appearance of a starry sky. So if you imagine that the background is the sky, you will see stars in the sky. They're shown right here. You should also note that the Burkitt's lymphoma is due to the translocation of the chromosome 8 and 14. So chromosome 14 is coding for the heavy chain immunoglobulin, while chromosome 8 is coding for c-MYC, which promotes the cellular proliferation. Next, we have the mantle cell lymphoma, which is positive for CD5 receptors, and this type of lymphoma is caused by the translocation 11 and 14. So I just mentioned earlier, 14 is with the heavy chain immunoglobulin, while 11 is coding for the BCL1 gene, which produces the cyclin D1, which interacts with the cyclin-dependent kinase to help regulate G1 to S cell cycle transition. The next condition is follicular lymphoma, which is caused by the translocation 14 to 18. So 14 codes for the heavy chain immunoglobulin, while 18 codes for the BCL2 gene, which prevents the apoptosis. And then finally, we have the diffuse large cell B lymphoma, which is the most common adult form of non-Hodgkin lymphoma that presents with a large transformed B cells with prominent nucleoli and basophilic cytoplasm. So here I've provided you with a memory aid to help you remember which translocations are associated with Burkitt's lymphoma, mantle lymphoma, and follicular lymphoma. So you will have to memorize this sentence: bird, man, flies. So in the ascending order, that's how the translocation are occurring. So one thing that you should always keep in mind is the chromosome 14 is affected in all of these conditions. So with all of these conditions, you will have chromosome 14 translocation. And then in the ascending order, we have 8, 11, and 18. So that's how I know the order that starts from the lower number goes to the higher number. So bird, man, flies. Burkitt lymphoma is associated with translocation 8 to 14. Mantle is associated with 11 to 14, and then follicular 14 to 18. The next two disorders are the T-cell origin lymphomas, including the mycosis fungoides, also known as the Sézary disease. And this type of T-cell lymphoma presents with the eczematoid skin lesions, and then on histology you will see these lymphocytes that have the cerebriform shaped nuclei. So if you look at the nuclei in these lymphocytes, it has a brain-like or cerebriform structure shown right here. So all these resemble a brain gyri. And then finally we have the adult T-cell lymphoma, which is caused by the HTLV1 or human T lymphocyte virus 1, and this condition is endemic in Japan, Caribbean, as well as West Africa. And these patients present with skin lesions, lymphadenopathy, as well as splenomegaly. And that concludes our discussion.